Valeria Leon reports on the rise of vaccine tourism.
Frustrated and with no idea of when she might be vaccinated, Pilar Gonzalez took a 2-hour flight from Mexico City to San Antonio, Texas, to receive her first dose of a COVID-19 vaccine.
The Mexican government said the vaccines were on their way, but they never got here. Then they said they were going to get the Russian and the Pfizer vaccines, but nothing came of it. And so I had the chance to go to the U.S. instead. That was a lot easier.
She's far from the only Mexican to head north for a shot. Politician Mauricio Fernandez posted his vaccination in Texas on social media to encourage others to do the same.
It's an open secret that people are traveling to the US to get vaccinated, especially to Texas, but also to Florida. A lot of people have talked about how easy it is to just rent a car, get in line and get a shot at the vaccination sites there. Nobody ever asks them where they come from or if they are US residents.
Mexico was the first country in Latin America to receive the COVID-19 vaccine. It began vaccinating health workers in December and people over 60 years last month.
Entra en la página https://.
The government launched an online platform where the elderly can register for vaccine appointments. But it was quickly overwhelmed and millions of Mexicans were left waiting in a country with the third highest death toll in the world. Once it started working again, a week later, many had to wait hours in line to get the shot.
I've been here all day and all night, and they just told us there are no more vaccines left for us.
The situation worsened after an unexpected vaccine production cut at Pfizer in mid-January. It led to Mexico receiving less than half of the doses it initially ordered. Of the roughly 1 million medical workers in Mexico, only half have received 2 doses of either the Pfizer or Moderna vaccines, and around 73% have received at least 1 shot. These frontline workers have threatened to go on strike if all of them aren't given access to a vaccine in the coming weeks.
Between 12 and 15 of our medical staff have died of COVID at the hospital where I work, because so many of our patients are infected with the disease.
The majority of Mexicans don't have the option of traveling to the U.S. for a shot or 2. They'll have to go on waiting as the number of Mexico's deaths continues to rise. Valeria Leon, TRT World, Mexico City.